I have something very, very exciting to tell you. The Mohawk Valley Health System has received the largest donation in its history, and we also believe it is the largest gift ever given in this part of New York State. We are the recipients of a generous gift from the Wynn Family Foundation of $50 million. That is $50 million. And that money will be used to invest in increasing the health care services available in this region. And that will benefit the people that live here for years and years to come. So I am very proud to also announce today that this facility behind me will from this day forward be known as the Wynn Hospital. If you don't know, Steve Wynn grew up in Utica. He has very fond memories of his childhood here. He has a special interest in healthcare, and he knows a thing or two about construction. So we think this is a really good fit. Now, for those of us that have worked in healthcare this last year, we find it absolutely remarkable that we've received a gift of this size right in the middle of a pandemic, during the worst healthcare crisis in our nation. It has been quite a year. But I stand here in front of you today with enormous optimism, hope, and a vision for the future for healthcare and for all of Utica, thanks to the generosity of the Wynn Family Foundation. We will see advances in healthcare and in training and equipment, and that will allow us to be more competitive in attracting physicians, nurses, and other healthcare professionals to this region. And that's what truly makes a difference in healthcare. So we couldn't be more grateful and thankful today to the Wynns than we just are. This is just a remarkable opportunity, not only for healthcare, but for all of us that live here. So with that, I want to thank you again and turn it over to Steve Wynn for a few remarks.
Well, it's not complicated. Darlene managed to get together over $500 million to create this facility in this community. A remarkable achievement for a city this size. My memories of my childhood, my family's wonderful life in this city was all it took for me to be attracted back to the area. We have our home up the road in Old Forge for the summer. And when I found out about the hospital and what Darlene had done, my own experience in creating structures had taught me that it wouldn't be the building that did it, although it couldn't be done without the place, but it was going to be the people. And I knew that Darlene was going to need the support of the community to have the kind of financial reserve strength necessary to keep the promise that the building would make. That is, to bring the best people here, to keep the best people here, to take care of the folks in town and in the valley and anyone else that needed it. So it was all about the people. My family foundation was thrilled to have the opportunity, in the name of the family, to give back to Utica some of the positive, wonderful energy and experience that we had here when we lived here. My childhood was dreamlike. Rode my bike to John F. Hughes School, walked through the woods, never locked the door, left the keys in the ignition. It was Dreamsville. The city is where I grew up, and I don't think I could have had a better opportunity in any place in America than here. But now we're in a different age, a different era. Technology has made the possibility of longer life happier life a real reality. And with this new hospital, which is, we're flattered to have her name on it, but its reputation will be made by Darlene and the people that staff it and take all the frightened and unhappy people that have to be in the hospital and give them a better tomorrow. I'm hoping that the rest of the community will get together as the months roll by. The building is topped out. It won't be long before it's ready for occupancy and usage. And at that point, I'm hoping that the citizens of this community, of this valley, will take the pride in it that the rest of us are going to take and support it with enthusiasm. My support and my family's support will continue for the next 10 years. Hopefully, I'll be around to look after that myself, but if not, others will be available. And that is basically the story. Excuse me for not looking right into the camera, but what I had to say stands. It's a community event. This belongs to the citizens of the Valley, of Utica, and they can help make it everything it hopes to be. But everybody's going to have to think about it and take a little responsibility for your new hospital. All of us will chip in and be there with you, but we don't want to be alone. So learn about the hospital. Darlene and the staff will explain it, and you'll find out what a remarkable achievement it was to bring a $560 million state-of-the-art hospital to Utica. Fantastic. Good for you.
Thank you. Now, I just want to be clear. I didn't do all of this, right? So Steve was giving me more credit than I have coming, because a lot of this was in place long before I got here. But I'm so thrilled to be part of the future of this community and of this hospital. And every dollar that we have received from this very generous family will go towards making healthcare a better place. And you have my commitment that we will spend every dollar with the community and healthcare services in mind.
This question is for Mr. Wynn. As you look at the logistics of the MVHS hospital, does it give you any personal satisfaction that your philanthropy is helping their project, which was directly across the street from your father's bingo parlor?
The irony of it is too much. The irony of it is too much. You know, we're replacing St. Elizabeth's Hospital ultimately with the new one. My backyard and St. Elizabeth's Hospital open onto the same piece of property, which is still the woods. I mean, it's so amazing, and I'm having a lot of trouble saying other than it's amazing to me and wonderful. I'm going to show the kids the house I was raised in, and the wonderful fellow that lives in it. Everything's exactly the same as when I was here. I left when I was 17. But we're back. We're back in the Adirondacks. So I'm still part of the scene.
Mr. Wynn, is this the first hospital that you've made such a large donation to?
Yes. The foundation supports a number of charitable institutions, including medical research and schools. And I think that's probably the best use. You know, if you get lucky in life, you gather money together, and as you get older, there's only two things left to do: spread it around to do some good for other people, and be grateful for the time that you, and have fun doing it. What fun it is to be in Utica on a sunny day like this and talk about these things with all of you. Really terrific. And it'll give me an excuse to be here all the time as we pay attention to the task ahead.
That was my follow-up. Will you be here for the ribbon cutting?
Well, I'm going to be here for more than the ribbon cutting. I'm going to hang out just behind Darlene to help her execute this plan. Because sure as the Lord made little green apples, there'll be some bumps along the road. With a project this ambitious, especially as complicated as one involving medical science and technology to the extent that it does, stuff happens, as you can imagine, and they're unexpected, and usually they involve costs. And so finishing this, putting up the steel is pretty straightforward, but the finishing of it. And what about the changes in medical science and the equipment that supports medical science that will undoubtedly take place as we go forward? Will this institution have the flexibility to adapt and to adopt such beneficial changes? I sort of think that it's the job of our family foundation to help our Darlene meet that moment. So for that reason, I'll be a regular. Sure.
And he promises that he knows some people that can come and throw us a big party, right?
Okay. So I did something else for 50 years. Got to do something in the interim. But here we are at a happy occasion. It's quite a thing that's happening in this community, if you all think about it. You all think about it. A hospital of this magnitude in a town of this size. When I lived here, there were 150 or 60,000 people in Utica. And because of changes in commerce, it retrenched to a third of its former size. And now it's on its way up again. And this is a boost. And Hamilton College is up the street, and Utica College. I mean, things are getting exciting here in the valley.
Okay, and you are a boost to this economy and to this project. You and the family, the Wynn Family Foundation, we couldn't be more grateful. This is a wonderful legacy that you are bringing to your hometown, and we are so delighted to have you back and part of our future. So thank you, Andrea, Nick, and Alex for being here. I'd also like to just point out to the media that we have some other people that you maybe even want to get a comment from. Bonnie Woods is the chairman of our board. She's here. Linda Romano is the chair of our capital campaign. And Linda Cohen is one of Steve's childhood friends. So thank you all for being here today. Thank you, guys.